Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty appointment at Ross University School of Medicine. And in this lecture, in this talk, I want to be quickly going over some of the ideas of epilepsy and how it creates stigma. So I'm trying to amass kind of places that stigma was felt. And this one goes into something called the iSync personality questionnaire. And that is actually one that I kind of used for a questionnaire. And then the quality of life, which has 31 questions. And then the depression scale, which has 17 questions. So all of these individuals had taken the depression scale and scanned with the diffusion tensor imaging and 3 Tesla MRI. And so this is how it was determined. Now, stigma, with the highest score being score 3, stigma scores were significantly negatively correlated with education. So higher the education, less the stigma. Age of onset, extroversion score of EPQ, total and all, the subscale, quality of life scores. So that you can actually read a lot from the abstract, and it's actually beyond the scope of this lecture to go through the whole paper. But felt stigma in epilepsy is something that's a real thing, and needs to be addressed. So just diving into this, about 1%, and this is something that's commonly used, 1% of people worldwide, but that's a significant amount when you're looking at 50 million, have epilepsy, and nearly 80% of cases occur in developing countries. So this stigmatization is a major contributor to the burden associated with the condition. So this was something that was done in the hospital setting, and the statistical analysis is always good to know, and a lot of this was chi-square, and then correlation testing, so that's always interesting. And then here we go, factors correlated in felt stigma in epilepsy patients. So patients felt stigma were found to have shorter education years. Again, longer duration and a younger age of onset. These are always kind of like red flags for stigma. So stigmatized epilepsy patients manifested higher HAMD score, higher psychoticism and neuroticism, and then a score of EPQ scale and lower quality of life, which is understandable. No differences were found between epilepsy patients and without stigma. With and without stigma. So feeling of stigma and neuroticism. So this goes through a lot of the discussion and looking at comparison to previous studies. I think this is one that, if you're doing any research on stigma, previous epidemiological surveys showed that incidence of stigmatized persons are 30 to 62.5% in European countries, and in China, about 40% of people with epilepsy did not tell others about their disease, which could be a symbol of stigma, and 36% thought that people treated them differently because of their epilepsy. So there seems to be a lot of stigma attached to seizures. I mean, I personally know of seizures being a potential sign of of the evil eye, or some belief systems which are not used anymore. But there is quite a few sort of alternate theories about how seizures take place, which of course modern medicine has surmounted, but people still believe that. So in a place that's restricted, then you want to kind of hold like community level meetings. Alright then, okay, so we're looking at functional MRIs, subcortical, amygdala, and cortical responses, all sorts of types, the ventral medial prefrontal cortex, so all the different areas, and in epilepsy patients, white matter abnormalities have been identified in several studies. Besides the point, even the important of one of the important studies reported to be contributed to neuroticism and depression and schizophrenia. In this study, we enrolled the patients. They enrolled with epilepsy of genetic or unknown etiology to avoid confounding impacts on DTI and psychosocial factors from the lesions themselves. So it's a quick run through this recording. If you don't have the paper in front of you, then the title of the paper is Felt Stigma and its Underlying Contributors in Epilepsy Patients. Thank you for listening.